reduce neuropathy that's available. But we use the same drugs that we use very often to treat other forms of neuropathy are often used and sometimes successful for patients with chemotherapy as well.
You know, recently I heard from an acupuncture physician who said she's had a lot of success helping people after they have had chemotherapy and they complained of neuropathy. Have you heard of that?
I'm sorry, I didn't.
Acupuncture physicians.
Oh, acupuncture. Well, people have had acupuncture for all types of painful disorders and successfully. So it's quite possible.
Yeah, working along with with traditional medicine, maybe you just try everything so that you can get back to what it is. Once you have neuropathy, can you ever cure that in someone?
Well, if it's a metabolic reason, if somebody has vitamin B12 deficiency, which is not all that uncommon, and you correct it and replace the B12, and sometimes has to be done by injection forever, patients can improve. Patients have what's called infectious polyneuritis, which is another very serious form of neuropathy, otherwise also known as Guillain-Barré syndrome, which causes paralysis. Those patients, if they're treated quickly and properly, will recover and can recover most of what they've lost. So, yeah, certain types of neuropathies can be, quote, cured, but not really cured in the sense that you have somebody has a pneumonia, they take an antibiotic, and then it's cured.
Right.
So you can control patients quite well.
And how about exercise and diet? Is that something on your list?
Well, we often recommend multivitamins to patients with peripheral neuropathy. Exercise is generally good for everything, so there's no real contraindication, meaning you shouldn't do exercise if you have peripheral neuropathy. Oftentimes, people have to take diabetics, of course, have to take very good care of their feet. And that's very, very important because if they develop severe neuropathy and they lose feeling in their feet and they're walking around the house barefoot, they can bump into something and not even be aware of it. So that's also very crucial.
I'd like to get back into neuropathy so I can really understand this better. So what's really happening to the nerves? Why are they damaged?
Well, sometimes it's a direct effect of the disease itself on the peripheral nerve. Sometimes, diabetes, for example, is a disease that really affects small blood vessels. And nerves, just like other organs in the body, receive their blood supply through arteries. And if these small blood vessels that go to the nerves are damaged because of the diabetes, then these nerves are going to be damaged as well. Sometimes there can be a toxic effect directly on the nerves. And there are certain neurotoxins that can cause nerve damage. So what happens is the nerve endings don't work as well, and it's manifested itself by numbness, tingling, burning, pain, weakness. Sometimes it's one of the above, sometimes it's all.
And I think recently I had a friend who said she had fibromyalgia and that some doctors don't really think that that's real or a disease. And is
Right.
that... Tell me about that.
That's a whole other topic in itself. I mean, fibromyalgia is not a peripheral neuropathy. And fibromyalgia for many years was just dismissed as a real non-disease and mostly seen in neurotic, middle-aged women more than men, with both sexes. And it was sort of dismissed as these patients were neurotic and these symptoms really weren't real. But over the last number of years, I think it's been shown that there are what we call central mechanisms involved with fibromyalgia. In fact, I've done quite a few clinical research trials investigating medications for fibromyalgia. And over time, although it's really felt to be a rheumatological disorder, I, as a neurologist, have seen many patients with fibromyalgia, having done many clinical trials for this disease. In fact, several of the drugs we tested are now on the market, such as Lyrica, such as Sabella, and we did the trials here. So I do believe that there is a central nervous system problem in these patients who develop severe muscle tenderness throughout their bodies. It's associated with a lot of other issues such as memory loss, sometimes headaches, general malaise, just feeling lousy, diffuse pains all over the body, oftentimes gastrointestinal effects as well. So it's not just the muscles that are involved.
Such a pleasure to talk to you. There's hardly a question I can answer you, question that I can ask that you don't know the answer. That's great. Really, I'm sure people listening are saying, "Wow, I got to go to that doctor." I mean, he's so smart, and that's why we have the radio shows because a lot of times people advertise their clinical studies and things, but until they really hear you personally like this for a half an hour, they don't really get it. And it's such a privilege for us to have you on our radio show, Dr. Singer. I must tell you that.
Well, thank you very much.
Yeah, it is, because I myself always learn, and I know that our listeners are learning great deals. And now I want to get back a little bit in the time that we have, talking about the drugs. And not everyone wants to take medications, prescription drugs. Tell us, I know, and you have been in the process of doing clinical studies about what drugs will help you. So I guess it's, do you want to suffer and have pain, or if this drug will help you, isn't it better to take it? And yet there are always some side effects.
Absolutely. Any drug can have side effects, but I should tell you and tell your audience also, we've been investigating topical drugs, so they're not absorbed systemically into the body, such as patches, such as certain types of creams that go on the extremities. There's a drug called Lidoderm, which is a patch. Many of your listeners may be familiar with this, which is really a local anesthetic that gets direct absorption, but a minimal amount gets absorbed into the system, so it doesn't really interact with other drugs. We've been involved with testing certain types of capsaicin patches and capsaicin creams, because capsaicin comes from chili peppers, and actually can be, at the right dose, effective in controlling certain types of nerve pain. A substance we tested here called Quintessa has just been released on the market for patients with severe post-herpetic neuralgia, which is from shingles, which is shown to be effective as well. So these drugs are put on directly onto the skin, and only a small amount is really absorbed into the body to really interact with other drugs that one may be on. But the drugs that we're using include Neurontin or gabapentin, which has been around for a long time, Lyrica, also known as pregabalin, and we did the studies for painful diabetic neuropathy with Lyrica and shingles pain, as well as fibromyalgia. And some people have trouble tolerating Lyrica because sometimes it causes drowsiness, and sometimes it causes weight gain, but usually in a small percentage of patients. And I should emphasize that a lot of patients have come in, they've been on drug X and they've been on drug Y and it didn't work. And I always find it very important to find out, number one, what dose they were on, and number two, how long they were on the drug for, because in my experience, one really needs to get the patient to the maximum tolerated dose. And oftentimes patients are put on a drug and they say it doesn't work and they stop it before they've really had a chance to know whether or not it would be beneficial to them.
That's a very good point. And when someone comes in and they do, if they're eligible to be a participant in a clinical study, what actually happens? And can you take us through one of the studies maybe that's going on now or that you've just completed so people don't feel so nervous? What does it really entail?
Well, first of all, some of my own patients I may refer into a study, but other patients come from outside physicians, and some people may see some of our announcements in the local newspaper. So what happens, they call in and they screened on the phone. So we have staff that actually screens the patients to make sure, number one, they have the right disease for the study program, and that they qualify in terms of the medications they're on. Sometimes they will not qualify if they're taking certain medications and they have to be off of them. So we have to do a careful screening process on the phone, and then if they seem to qualify, we bring them in, and at a screening visit, they'll have to read and sign an informed consent document, which explains the entire study in detail. And it also explains that for any reason it's completely voluntary and they can drop out at any time as well, because they're completely free to do that. And these studies are sponsored by pharmaceutical companies at no charge to the patients. Sometimes the patients are compensated for their time and travel as well. So they'll come and they'll be screened. Screening means they'll have a physical examination by a physician. They'll have laboratory work drawn and sent to the lab. They'll have cardiograms done. In some of the studies, they may need to have an eye examination or an additional skin examination by a dermatologist. And all of this is covered through the the budget from the study protocol, not by the patient nor their